A very good evening. I'm Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New Jersey. Welcome to the show. It is the night before New Year's Eve, so we hope that you are surrounded by your loved ones and that the new year 2022 brings in much happiness, peace, and prosperity. Let's now begin the episode taking a look at the coronavirus pandemic updates as well as measures. The world is at more than 285 million COVID-19 cases and more than 5 million deaths. India, home to many of our viewers, is now seeing a sharp COVID-19 surge worsened by the 2-week-long doctor strike leading to the frontline shortages. Here in the United States, we are at more than 53 million COVID-19 cases and at least 821,000 deaths. Again, if you have not gotten your COVID-19 vaccine, please visit vaccines.gov. It is the website with all necessary information. About 62% of our population right now is fully vaccinated, but we need more. So make sure to help do your part. On vaccines and Omicron variant, we have tonight top health experts from the tri-state area bringing much needed insight. Here are the headlines for tonight. Dr. Anthony Fauci warns against attending large gatherings. Dr. Tushar Patel, New Jersey. Experts warn of Omicron blizzard ahead. Dr. Sandeep Jain, New York. Dr. Daniel Varga on COVID-19 updates and measures. Hackensack Meridian Health, New Jersey. It's time for a short break on Vision of Asia South Asian News segment. Don't go anywhere. We'll be right back. On coronavirus updates and measures, nation's leading health expert Dr. Anthony Fauci has now warned Americans to not attend large-scale gatherings, especially with New Year's Eve tomorrow, and suggested that people opt for small, intimate gatherings with vaccinated and boosted people. He then said if your plans are to go to a 40 to a 50-person New Year's Eve party with all the bells and whistles, he strongly suggested that you opt out of those engagements. Cases are rising across the nation. So the focus now continues to be on vaccinations across the nation as well, with now a push to inoculate young adults and teens with a booster dose. On this and much more, we have now our conversation with ITV Gold's health expert, Dr. Tushar Patel. Here is Dr. Patel. However, some universities are going virtual, doctor. What do you have to say about that?
I think there is no reason, unless there is a specific pocket of areas where there is a huge number of cases which are not controlled and they have some severe symptoms coming from those individuals. My recommendation is there is no reason for any schools or universities right now to be on a virtual. They can safely go back to the schools or the universities as quickly as possible.
So, Doctor, Israel has announced that they're working on a 4th vaccine dose for the COVID-19 vaccine, and they're researching on what to do in a couple of more months after the booster dose. What information do you have about it, and are we going to just have to take a shot every 6 months?
My recommendation, my guess is we will need to take the vaccine probably once a year. I think we will, for this pandemic, we may still need to take one more booster shot. That will be between March and May, depending on how this winter rolls into. But after that, it's going to be a yearly deal. We will be calling off this pandemic probably by middle of next year, but still the virus COVID-19 will be with us just like influenza for years to come, and we may need to take the vaccine every single year based on what strain of virus this COVID-19 gives us every single year.
What is your biggest concern right now?
My biggest concern right now is the testing. By mid-January, our numbers will definitely hit 500,000 to million case every single day. And if we don't have enough testing available, I think we will continue to spread. It's going to be a bad news, but it's the good news. We may have that community or population immunity by infecting this many people, and hopefully by spring we can call this pandemic off. So I think the testing is the biggest concern, and I think a lot of misinformation about the vaccination.
Yeah.
A lot of people are not still vaccinated. About 80 million eligible individuals have not received a single dose of vaccination in the USA. I think those are the hurdles we need to probably reach before we can have this pandemic called off.
So, what do you suppose that this administration do at this point? Do you think they can mandate perhaps vaccines? What is the smartest move in that sense?
So the first thing government need to do is to offer free testing to
Right.
all individuals who need the testing. And the second one is to have the mandate for the government is almost mandating right now the public transportation, the universities, the schools, the private sectors. They all need to be in this together, and at only time then we can safely say that we are in probably calling off this pandemic.
Right, and this brings me to another question, which is really important: masking up. The president has encouraged it. The governors are encouraging it. Everyone's talking about it. It's become a political issue again. What's your medical opinion on that, and how important that is?
So right now with this rise in Omicron variant, I think my sincere advice, sincere recommendation is to mask up. If you are going in a grocery store, if you're going in a public places, mask yourself even if you are fully immunized. There is no reason for you not to wear the mask. If you're outdoor, if you're at the small gatherings with your immediate family where you know everyone is okay, there is no reason for you to wear the mask. But if you are at the public places, if you are indoor, definitely masking is the game.
Two more questions left for you, doctor. I have here a question about the therapeutics. We're hearing that there's an antiviral pill by Merck and also Pfizer that are in the works, and they could be a big game changer in terms of treatment of people when they get COVID-19. What is your take on it? What information can you give us?
So Merck and Pfizer both has antiviral medication available right now as we speak. If you have a prescription from your doctor, you can go to the local pharmacy. Emergency authorization was given to both medicines last week. If that medication is taken within 5 days,
Yeah.
one is effective 30%, the Merck one and the Pfizer one is about 85% in reducing the severe symptoms. There are some side effects, some drug interactions. You want to discuss that with your physician, but that's a good news. That's a game changer for those individuals who get the infection. There is no prevention from this medicine. It's only after you get the infection you can take that medicine within 5 days and reduce the severe symptoms.
To think last year we were not even close to this, and now we have so many, things at our disposal, such as a vaccine and now this antiviral pill. What is your prediction for the rest of the month of January and February?
So my predictions, like I said earlier, more than 500,000 to million cases will start seeing by mid-January. That will help in community immunity, population immunity, herd immunity, whatever you want to say. And I think my guess is by April, May, I think we will be in a different scenario with this pandemic. WHO and CDC and everyone probably will call this pandemic off and will announce as endemic, just like influenza. And that is my educated guess based on what we have seen in last almost 20 months.
More on COVID-19 updates and measures. Today, health experts urge Americans to prepare for a severe disruptions in the coming weeks. The rising wave of COVID-19 cases led by Omicron variant has threatened hospitals, schools, and other sectors, impacting daily lives of many. This warning comes as we approach the New Year's Eve celebration taking place all across during the rise in cases. Even federal officials have issued more travel warnings, and airlines have cancelled more than 1,000 US flights today and have already cancelled 500 for tomorrow, all because of the threat of the Omicron variant. So again, please get your vaccine shot or the booster dose as soon as possible. Visit vaccines.gov for more information. We have now a segment of our conversation with Dr. Sandeep Jain. Here is Dr. Jain. What do you think we all should be doing right now, doctor? Because obviously cases are increasing, Omicron is a threat. The vaccine is not fully effective against it, so that's also another worry. What are some of the measures you think we should all be taking?
So we should continue to wear masks that would actually protect us, such as an N95. Definitely get your booster shot. And if you get the Omicron, don't panic. You're going to be fine. If you start to have symptoms, then you have the options of getting antibody treatments.
Yeah.
And if you qualify and you're a high-risk person, you can get the antibodies in any urgent care. You can get it in a hospital emergency room as well. There is no point in going and getting tested and overwhelming the system.
Yeah. Masks have also become a political issue across the nation, where some, politicians are using this to combat their own, status in their politics. What do you have to say about that? How important do you think these masks are, especially, for students, for people that are traveling, for even any indoor settings where you do not know the vaccination status of everyone? The importance of that, according to you.
Yeah, I believe Trump overly politicized the use of masks. It's actually one of the most effective ways to prevent transmission, except for this Omicron variant, of course. But there's a deeper psychological issue at play here. Our brains are wired, and fear and survival is wired into our brains in the limbic system. If I see another person wear a mask, I'm going to be fearful regardless. Now, unfortunately, this is an airborne infection, and until we get rid of it, have a pill that cures us all, we will have to wear masks. And as long as we continue to wear masks, I believe there will be fear in the environment, and the economy is just going to take over.
Yeah. Another big news that has been coming in, it's also concerning, is the fact that hospitalization in children is also rising up across the nation. I know that children have a very severe, they do not have any severe symptoms from COVID-19 if they're infected, and they're not affected as much. But how worried should we be about that, hospitalizations of children? And what do you say to parents that are still choosing not to vaccinate their child?
So again, to answer the second question is easy. If you're a parent and you've chosen not to vaccinate your child, I'm personally okay with it, as long as you understand what the pros and cons are. Going back to the first part of your question, which is, how concerned one should be about the increasing number of hospitalizations of children, I believe the data needs to come out even better. This is the flu season as well. So you have a combination of flu, you have a combination of other viruses, and then you have COVID. So I'm not so sure as to where the numbers are and what was the pathology there, but we might be on to something new. Now, one reminder I would ask the viewers to really pay attention to is that there's a very nice movie called Don't Look Up. And if you watch that and you look at the viruses and what's happening with the COVID virus, we really have to be careful. The Omicron variant has had 30 mutations out of 50 on the spike protein, which means those mutations are really significant, and all the vaccines that we took might become useless going forward. That's one aspect. The second aspect is, typically viruses, when they are very virulent or they're deadly, they usually, once they've spread enough, they go to a level which is of low, we call it low attenuation. So they're not as infectious. And we know that from the 1950s, where humans introduced myxoma virus in rabbits. After 10, 20 years of seeing them, the virus actually mutated to a lower level. This is not happening with the Omicron variant or the Delta variant. This virus is making it worse every time it comes up with a variant. So all the media out there and all the news out there, we all need to be really listening in and paying attention to it. And I believe there's a time that's going to come that this virus might become even more infectious and deadly. The Omicron variant is not as deadly, but we need to really be careful. And one thing that would really, really help is as many people taking the booster shots. That is the key for all of us, at least in New York, in the tri-state area.
Definitely. And vaccines.gov is the website to get more and more information on the vaccine and locations. Doctor, also Israel has announced that they are working on a fourth dose of the coronavirus vaccine. What information could you give us about that? And do you think we will need to take this every 6 months or so?
Yeah, so Israel has had a deal with Pfizer where it's almost like a microcosm of an experiment going on. And they have chosen to take a fourth dose, and I'm sure to boost the immunity. I just don't know, and the data will need to come out for us to see what happens by giving the same dose a fourth time. In terms of I'm sorry, what was it, the second part of your question?
Oh, we were all just talking about how significant would that be, and would we need to take a shot every 6 months or so? Like we do
Yeah.
with the flu shot, we take it yearly, but this one it seems like every 6 months there's a new dose that's introduced.
I hope not, and I hope it's only once a year, like the flu shot, because I'm sure, just like me, all of us are having vaccine fatigue at this point in time.
Yeah. What are you the most worried about right now, doctor?
Well, I'm worried about how this virus is getting worse and worse, unlike the myxoma virus, for example. And I'm quite stunned at the infectivity of this current strain. So if anybody's breathing air and exchanging air in a room, you're going to get it. It's 40 times more infectious than the original virus.
Oh, wow.
I don't know how anybody can fly in a plane and not get it. I don't know how you could be in an elevator and not get it. So the best thing that you can do is probably wear an N95 mask when you're out with people and just wait for it to pass. It will pass. I believe in a couple of weeks it will pass.
Right. And many experts are saying that testing is key right now to really truly curb this pandemic and slow the spread of this disease. What do you have to say about that? What are you seeing in terms of testing?
Yeah, I think when the infection is so widespread, testing is not helpful. I think what's going to be helpful is people quarantining themselves or wearing masks and then just going about their way of life, and only if they have symptoms to get tested. So if you have symptoms and you're in the high risk, especially if you fit the high risk category, then definitely get tested because you have an option of getting antibodies.
Many South Asians are at high risk. What's your biggest advice for them?
Yes, you need to take all your medicines and you need to be very careful. If you get fever, fatigue, sore throat, cold, get yourself checked for flu, get yourself checked for COVID. And the earlier you get your antibody treatment, the better your outcome will be. Again, this is not a deadly virus as yet. It is causing very mild symptoms. So things are going to be okay.
For the second day in a row, the United States has had record number of new cases with more than 290,000 new infections each day. Dr. Anthony Fauci, nation's leading health expert, has said that cases will likely rise throughout the month of January. Him and other U.S. health officials have also said that the focus and the push now remains on vaccinations, masks, and physical distancing. President Joe Biden also has announced new plans to combat Omicron, including federal reinforcements for hospitals and more tests. So, during this holiday season, please remember to stay vigilant and alert when it comes to the coronavirus. Keep up with the precautions and celebrate your New Year's Eve safely. On this and much more, we have now a conversation with Dr. Daniel Verga. Here is the conversation.
But no, so from the perspective of traveling, I mean, there's really two issues. I mean, if you're talking about airline travel, there's the period of time when you've got a bunch of people who aren't socially distanced in a relatively tight space, right? So that's the first issue. What you would really like, we already have masking mandates in that, but people have to take their masks off to eat or drink or whatever. And we know that the risk of transmission is lower with vaccination. So I always keep looking at this from the perspective of risk, and we understand that risk is a spectrum of, if you think about risk on a spectrum, you go outside is lower risk than inside. Vaccinated and boosted is lower risk than not vaccinated at all. You know, socially distanced is lower risk than not socially distanced. Masked is lower risk than unmasked. And I think as we look at travel, you know, all of those things should come into play. You know, the degree to which you can validate that people are vaccinated, the degree to which people are, you can make sure people are masked. You obviously can't socially distance on an airplane unless you really decrease the number of people on the flight so that you can space them out like we did kind of at the beginning of the pandemic. So I just ask people to think about that. It's practical, it's common sense. I'm boosted. If I get on an airplane, I wear my mask just like I'm supposed to. I think those are reasonable expectations for travel.
Yeah, definitely. I myself just traveled internationally, and you all had to wear the mask, and I kept it on the whole time because that is what you do to protect yourself and others around you.
You're smart.
2 more questions left here for you, doctor. I have to ask you, the therapeutics. We are hearing about this antiviral pill. I believe one is by Merck and the other one is by Pfizer, if I'm right. How big of a game changer is this for doctors? And how effective is it when somebody gets infected with COVID-19?
Yes. So particularly the Pfizer drug, which we're all anxiously waiting for, could very well be a big game changer because what it does is it kills the virus. It's not like monoclonal antibodies that the virus you become infected with it, and then you take the antibodies and it neutralizes the effect of the virus in your body so that you mitigate the symptoms. This is actually something you take the pill and it kills the virus. And that does 2 things. It, number 1, helps the individual who's infected not develop severe symptoms and get better faster. But it also decreases the viral load the individual carries, so it decreases the transmission. Now, the unfortunate thing for that is that it's going to be in relatively scarce supply for a while, and we'd ideally would have liked to have had it yesterday. The other thing that's a little challenging about the Pfizer drug too is that it seems to have some drug-drug interactions that you need to be careful of, and since a lot of the folks that you'd want to prioritize this sort of intervention for are folks with chronic medical illnesses. And I'm not 100% sure of all of the medications that folks have referenced creating interactions with this antiviral. But you got to be careful about that. And so how effective it'll be will really depend upon how many people can actually safely take it and how much of it we get how soon.
Yeah, definitely some good news that we are hearing, though, and it's always nice to get some good news during this pandemic. Doctor, my last question to you, I'd like to know your prediction for the next month. We're going into a new year. It's going to be January next week. What is your prediction for the month? What do you think is going to happen with cases and deaths? And what should we all watch out for?
So I think that in the short term, so let's say through the first 2 to 3 weeks of January, I think we're going to continue to see this rise in cases. We're preparing to really continue to have a rapid rise in cases in New Jersey and a rapid rise in hospitalizations in New Jersey. Just simply, even though the hospitalization rate is lower with Omicron, there's just so many more cases. So you're still going to have strain on the hospital resources. I think that the challenge for us in the near term is to not have the healthcare system inundated. We saw what happened to healthcare systems back in March, April of 2020, and the implications that had for the delivery of care other than COVID care. People delayed care that was critical. We had people dying at home instead of coming to the ED. And a whole host of issues. So we really need to make sure that the healthcare system is adequately staffed and has adequate capacity to be able to take care of everyone to the degree we can. But I think we're going to see a continued rise probably for the next 2 to 3 weeks. And if the experience in Europe and South Africa is any indication, it looks like as fast as this surge tends to go up, it tends to come down equally fast. And so we'll be hopeful that the U.S. trend, and we are, a relatively vaccinated country, not nearly as well vaccinated as we should be, or as some other countries are, but we'll hope to see that rapid rise is accompanied by a rapid decline.
With this, we wrap up our show for the night. Please send us your suggestions and get your voices and organizations on our show. You can email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Edison, New Jersey. This is Vision of Asia. I am Aditi Lamba. Take care and be well, and a very happy new year.